Histoplasma capsulatum by Thomas and Zavino. Histoplasma capsulatum is a fungus. It remains dormant in the soil until in a mammal, and then begins to multiply and form colonies. This fungus causes a disease known as histoplasmosis. The symptoms vary greatly, but it primarily affects the lungs. This fungus grows in soil contaminated with bat or bird droppings. In the United States, this disease is most common in the Ohio River Valley and the Mississippi River Valley. These areas have a higher instance of histoplasmosis due to high populations of bats. As you can see, areas such as this one must be contained because the soil is contaminated and can stay contaminated for years. The soil is contaminated with bat guano along with bird droppings, creating an environment suitable to histoplasma capsulatum spore growth. Spores become airborne during the removal of guano and increase the likelihood of contracting histoplasmosis. A clump such as this, found in an attic, can hold millions of spores and can go unnoticed until someone in the household contracts the disease. Due to the presence of bats and their guano, people who enter and work in caves have a higher instance of histoplasmosis. As you can see by the graph, histoplasmosis is most common in males, specifically between the ages of 30 to 39. This most likely has to do with the profession of bat removal or guano removal. However, bats are not the only animals associated with histoplasmosis. While birds cannot contract histoplasmosis like bats, their droppings are also a medium for the growth of histoplasma capsulatum. The mass production of chicken mass produces chicken droppings, therefore promoting the growth of histoplasma capsulatum spores. Prevention is the best way to reduce the spread of this fungus. Normally, masks are used. Gas masks prevent airborne spores from entering the lungs. The lungs become infected when a spore is inhaled and begins to colonize the lungs. This causes many common symptoms: fever, chest pain, and a dry or unproductive cough. As we can see in this diagram, colonies of histoplasma capsulatum look like furry, shaded masses. Rare, but not unheard of, is ocular histoplasmosis, which can be contracted by rubbing an eye with a contaminated finger. AIDS patients and other immunosuppressed people contract the most dangerous form, the disseminated version. This is when colonies form throughout the body, circulating through the bloodstream. The disseminated version causing most of the deaths. Histoplasma capsulatum causes about 800 deaths in the United States each year. Blood, urine, and other tests look for signs of histoplasmosis. Doctors will treat with a broad range of antifungals. Sorry if I'm pronouncing these wrong, they're on the top. Amphotericin B, itraconazole, and ketoconazole are the normal treatments. Here is my works cited. I hope you learned a lot about histoplasma capsulatum.